Thank you so much for joining us for another wellness webinar. We really appreciate you joining us today. I'd like to introduce our webinar today. We are here with another wellness webinar session. Today's session is our nutrition webinar series. We are joined by Michelle MacDonald for What is a Heart Healthy Diet? Michelle MacDonald is a clinical dietitian and certified diabetes educator at National Jewish Health. She provides compassionate, comprehensive nutritional care to adult patients with various chronic conditions, including bronchiectasis, cardiovascular disease, chronic kidney disease, chronic obstructive pulmonary disease, gastrointestinal disease, interstitial lung disease, non-tuberculous mycobacterial disease, obesity, rheumatoid arthritis, scleroderma, and type 2 diabetes. Michelle works closely with multidisciplinary teams of specialty clinics, counseling both inpatients and outpatients. She is dedicated to helping patients use nutrition as a supportive therapy to manage disease and optimize health. Michelle completed a Bachelor of Science in Human Nutrition at Cornell University, a Master of Science in Food Science and Human Nutrition at Colorado State University, and a dietetic internship at the University of Northern Colorado. Michelle also has some very good recipes that we are going to be and putting forward. Welcome, Michelle. So today you can post your questions in the Q&A box as the webinar goes along. You type them into the Q&A box, you click send, and at the end of the webinar, I will read the questions out for the speaker to answer. Don't forget about our upcoming wellness webinars. The next webinar in the mental well-being series is on Sunday, August 22nd. Managing stress levels while living with NTM and other lung diseases with Dr. Devin Smith. And that's from 1 to 2:30 Eastern Daylight Time. And then the next one in our nutrition series is on Sunday, September 12th, and it's How Safe is Sugar? We'll welcome back Michelle again at 4 p.m. Eastern Daylight Time. Don't forget to find us on social media and follow us. And learn more about us, sign up for our latest news. And when you do, when we open registration for our next webinars, you'll get that information right in your inbox. You can sign up at NTM Info and Research. Michelle, thank you so much for joining us again. We're delighted to have you back. And please talk to us about a heart healthy diet.
Thanks, Amy. I'm going to share my screen. Okay, and I'm going to start the presentation. Okay, hi everybody. Thanks for spending a little time with us on Sunday. I developed a presentation about a heart healthy diet, or how to heart your heart with diet. So as an overview, we're going to look at what is a heart healthy diet. I have a simple definition, the way I like to think about it. We'll look at why you should consider eating heart healthy. I think there's pretty compelling reasons. And I'll spend most of the presentation talking about the evidence base that describes what the optimal nutrition is for heart health. I think there's a lot of conflicting information out there online, in the media, and from people with even really good credentials. And I'm pulling from a course that I took from the Harvard School of Public Health. And so that I believe is the best source or one of the best sources, and is in line with a lot of the other top academies in terms of nutrition in the United States and worldwide. And so I want to give you that information as well, very directly, so you can get some clarity maybe on some issues that are somewhat controversial. And then we'll end with what to eat. You know, I like pictures, and so we'll end that way too. Okay, so in terms of what is a heart healthy diet, and I actually need to, there we go, I'm gonna hide myself. Okay, so in terms of what is a heart healthy diet, sorry, now let me move myself. Okay, I'm at the bottom of the screen now. Okay, better. So my simple definition is that it's a way of eating that protects your blood vessels and your heart, and it can make a very remarkable difference. And that is why the difference that it makes is why you should consider eating heart healthy. So in terms of the compelling reasons and how it makes a remarkable difference, if you're young, so I'm going to look at this across the lifespan, a teenager or even young adult, 20s or 30s, a heart healthy diet may help you avoid heart disease altogether. And I think this is powerful. Heart disease is the #1 cause of death in the first world, in the United States and worldwide. In the first world, it's really a first world problem, but it does not have to be part of the natural progression of your life. You don't have to just assume that because you are getting older, you will get heart disease. And this is where there's power, I think, in using diet and lifestyle to combat disease. So additionally, if you have high blood pressure, a heart healthy diet may reduce your blood pressure by 10 units or more. That's significant. If you have high cholesterol, which a lot of us do, it may lower your cholesterol by 20 to 30% within 3 months. So I would argue that this is just as good as medicine. Sometimes more, sometimes as good as, sometimes maybe not quite as, but oftentimes just as good as, if not more or better than some of the medications that you could take. And there are few, if any, side effects. One of the side effects, however, in the NTM bronchiectasis population that I see is that people restrict in a way that makes them lose weight. And so they can't maintain a healthy weight. And so I'm going to try and address that as I go through. And if we don't get to it fully, feel free to maybe ask some of those questions at the end. Okay. So other remarkable, compelling benefits are that if you are already of an older age, if you are already age 70 to 75 or have already had a heart attack and you feel that the damage has already been done, so why bother? A heart healthy diet may reduce your risk of having another heart attack or of dying from heart disease by 70%. Whereas the best drugs, the statins, by comparison, will reduce this risk by just 30%. So this is another remarkable benefit of something that diet can do for you. Again, in this case, with these statistics, diet is proven to be more effective or better than some of our best drugs. Okay, so I would argue that the earlier you start, the better, and it is never too late to start. In terms of moving to the evidence base for optimal nutrition for heart health, as I mentioned at the beginning, I took a course right before the pandemic hit that the Harvard School of Public Health put out, and it was for professionals, and it was giving the evidence base for optimal nutrition, period. They spent a lot of time talking about heart health, and so I've pulled the relevant pieces from that to share with you today. The course did kind of outline, it looked at the macronutrients and looked at them categorically. So we'll do the same thing. So we'll look at heart healthy fats, proteins, and carbohydrate. In terms of fats and heart disease risk, there are some better fats. And so the evidence, I'm going to go through some of the evidence so you can see it and understand it, and then hopefully tune out some of the other things that you might see in other channels, media, or elsewhere that might be confusing. So one of the big studies that looked at the connection between fat and heart health was the 7-country study. This was done by Ansel Keys in the 1950s and 1960s. There were 7 countries involved. There were 16 cohorts, 1,000 men, unfortunately no women in this, in each cohort. They were tracked over the next decade. And what was documented were the cases or the incidents and the deaths or mortality from cardiovascular disease. And so this is just one of the findings. What was found is there was a connection between how much saturated fat was in the diet and the incidence of coronary heart disease. And I think you can see it looks almost linear. So the more you have of saturated fat, it seems like the incidence goes up. So the conclusions that they came to, and this was observational data, but saturated fat was strongly correlated with heart disease rates. There was a 10-fold difference between East Finland that had the highest rates and Crete, which had the lowest rates. And they determined that it was not due to genetic factors. That might be something you might think, but at the same time, there were other epidemiologists or scientists who were looking at people who migrated from the low rate areas to the high rate areas, and their risk went up based on the move. So it wasn't something in their genetic makeup, it was something in their environment or diet and lifestyle factors that played a role. So this study is widely criticized as being correlational, which it is. It's an observational epidemiological study. And you can't just say that because we saw this in different populations, it meant that saturated fat caused heart disease. So Harvard actually took it upon themselves, and it was Dr. Willett, actually, he was a graduate student, I believe, at the Harvard School of Public Health. He decided to put together a large prospective cohort study. And now they have 30 to 40 years of follow-up data. So this started in 1976, and it was a great platform to learn about diet effects on heart disease. They adjusted for many confounding variables. And essentially what they did is they found people in 1976 who were largely healthy, and they tracked them for decades to see what, if any, diseases they developed and what, if any, deaths they had, and then what was the cause of death. And they checked their diet. They validated a food questionnaire. They checked their diet periodically through the years to see how it changed. They also checked their blood and then checked in on their health and any causes of death. And what they saw was that a Mediterranean style diet, which we talked about last time as being anti-inflammatory, decreased the risk of heart disease and stroke. And those are two of the main events that are potentially life-threatening with heart disease. They found that fish decreased stroke risk. That was another food that was mentioned in the anti-inflammatory webinar as being anti-inflammatory. And fish, as we know, a lot of them contain omega-3 fats, which can decrease the inflammatory response in your body. Also, nuts and whole grains decreased heart disease risk. So of the people, in that study, decades later, the people, again, that followed a Mediterranean style diet, ate a decent amount of fish, and nuts and whole grains seemed to have less incidence of coronary heart disease, heart attacks, and strokes. They also saw that replacing saturated fats with unsaturated fats decreased heart disease risk. And so this, to some degree, corroborated what Ansel Keys saw a decade or so earlier. So that was corroborational. However, there are still a lot of media reports saying butter's okay. This is just one of them. This happened, this wasn't actually, here we go, 2014. I have the data there. So this is just one big media outlet that was promoting butter. They had a big article in this magazine that talked about, that supposedly debunked some other scientific studies and went on to say that butter was good for you in terms of a heart health perspective. And so Harvard actually did a very direct butter fat analysis in order to kind of combat some of this. And this is one of the reasons why I actually like the Harvard School of Public Health. They actually take on a lot of messages in the media that are confusing, and they not only talk about the rationale behind why it may or may not be true, but then they actively do research to try and demonstrate that. So they looked at replacing butter, taking butter out of the diet and replacing it with other calories. They adjusted for confounding variables, and what they saw is on the left, you'll see fats that were put into the diet when butter was taken out. And then you'll look at what happened in terms of the risk of disease or problems. And you'll see that when, for instance, top one here, vegetable fat, when that was put into the diet, when butter was taken out, you have a lower risk. And you go down the line and everything is lower risk with the exception of if you replace butter with other animal fat. So they looked at polyunsaturated fatty acids here, or PUFAs, that included omega-6, omega-3s, that's alpha-linolenic acid, and which is a plant-based omega-3, and then marine-based or fish-based omega-3s here. They also look at whole grains, and they even looked at it, what happens if you take butter out and you put in processed refined starches? And there was a neutral or kind of small, maybe a reduction in risk, but it almost looked like this was about the same as having butter in there. So refined starches aren't necessarily better for you. Okay, so their conclusion is that replacing butter fat with vegetable fat and other polyunsaturated fats, whether it be omega-6 fats or omega-3 fats, did decrease heart disease risk. So that's how they answered that question. So to date, we still don't recommend butter in large amounts if you want to be as protective of your heart as possible. As a little side note here, if you're trying to gain weight or you're underweight again, and you're trying to either maintain that weight or restore your weight, or maybe put on a little weight for a protective effect, and you like butter better, I'll probably liberalize some of these recommendations to allow you to eat what you like, because then it's easier for you to get the calories that you need to maintain a healthy weight. What's interesting though, is that, just as an aside, butter is 80% fat. There's 20% solids like protein solids, milk solids, and moisture in butter. So olive oil, or any kind of oil, is 100% fat, which means there's actually more calories. If you're looking for calories, there's more calories in oil than there is in butter. So oil is actually more quote unquote heart healthy than butter. And there's more calories. So I tend to push people in that direction because you're winning on both fronts. But if you like butter and you'll eat more of something when butter is in it, then that's a clearly good path to choose as well, when your primary issue may just be that you need to maintain a healthy weight in order to help your overall health status with lung disease. What else did I want to say on this? I think that's it. Okay. So here's another trial that was done. This is actually I consider this to be almost like a landmark trial. It's referenced quite a bit in the literature. It was the PREDIMED study. It's a primary prevention trial that happened in Spain. Primary prevention means you take people who are not sick, they don't have heart disease, they're generally healthy, they haven't had a heart attack or a stroke, and you test them to see what might increase their risk for having heart disease or having a heart attack or stroke. So this was done in 2006 to 2013. It was done at many centers. It was randomized and single-blinded, so not double-blinded, not the gold standard per se, but at least single-blinded, and it was a controlled trial. They had about 7,500 men and women who had a high risk for a future heart attack and strokes, but they did not have a prior history of it. And they followed up for about 5 years. So the participants were randomized to one of 3 diets, either a Mediterranean style diet with additional extra virgin olive oil, or a Mediterranean style diet with additional nuts. And they were given either additional oil or additional nuts, or they were given a control diet, which essentially meant that they were counseled to follow a low fat diet. And this is kind of a summary of the dietary recommendations to participants in the Mediterranean diet groups, which is up top, versus the controlled diet group. And what you'll see on the Mediterranean diet is we have olive oil, there's nuts, there's fruits, there's vegetables, and you can see the servings on the right. There's fish, especially fatty fish, at least 3 servings a week. A serving is about 4-ounce portion size, or really the size of my hand. Legumes are beans. Sofrito is like a saute of tomato and onions. White meat instead of red meat, and red meat includes beef, pork, lamb, and then wine with meals. It looks like they had at least 1 glass of wine a day. And I actually had the opportunity to meet the authors of this study at a conference, and I have to admit, they were fans of wine. It's a cultural difference, I think, between Europe and the United States. And unfortunately, I say unfortunately, but I'm not going to necessarily recommend you start drinking wine if you don't already, in part because it's a reflux trigger, and also because depending on your situation, there are other disadvantages you might want to consider. In my case, I consider the cancer risk with additional alcohol. Just know that in Spain, they built that in, and it was part of the Mediterranean diet. What was discouraged were sugary beverages, lots of sweets, solid spread fats, and red and processed meats. The low-fat diet, they recommended low-fat dairy, some grains and starches. You'll see fresh fruits, vegetables, and some lean fish and seafood. What was discouraged were the vegetable oils, including olive oil. Again, sweets, nuts were discouraged because they were high in fat, fried snacks, and red and processed meats, as well as other fatty foods. Okay, so what they saw is that there were significant benefits for people who did not have prior heart disease. Again, it's a primary prevention trial. The study was stopped before its intended end. It was considered unethical to continue due to highly significant differences. So what they found, when they looked at whether or not someone had a combination CVA, that's a stroke, or an MI, that's a myocardial infarction or heart attack, when they looked at how many people had a stroke, a heart attack, or a death from heart disease, in the Mediterranean diet group that had extra virgin olive oil, or EVO, there was a 30% decrease in risk in all of those things. For the nuts group, there was a 28% decrease in risk, and it was found to be highly significant. So again, they stopped the study. Okay, so before I move on, let me just say on this point then, what we're looking at is this was kind of additional evidence that olive oil, particularly extra virgin olive oil, and other healthy fats, particularly those found in nuts, were heart healthy. Okay, moving on to the next topic then. Coconut oil and palm oil have been and are popular. And so this is under the fat topic. But coconut oil and palm oils are popular, especially in diets like the ketogenic diet or the paleo diet. And it's hard not to go into the store these days or even just look at media and not be bombarded with messages that whether it's butter or coconut oil are good for you. So in terms of looking at the evidence, note that palm oil comes from the fruit of the oil palm tree. It contains palmitic acid. That is a fat. It's a fatty acid. It's long chain. It's saturated. Palm oil also contains some medium chain fat. So palm oil is a saturated fat. What the evidence shows is that in controlled feeding studies, palm oil does raise your LDL cholesterol compared to unsaturated plant oils, such as olive oil or sunflower oil or avocado oil or others. And controlled feeding studies are good because you're feeding people everything that they eat. They're not eating outside of a controlled feeding study. So palm oil, which is again highly saturated, was demonstrated to raise cholesterol. And LDL cholesterol is one of the strongest predictors for heart disease and heart events. In terms of if it's high, you have higher risk. Here's another study that was presented. This was done in Costa Rica, where apparently it's more common that people consume palm or soybean oil. And in this study, when palm oil is used for cooking, it's associated with a high risk of heart attack, 33% increase in risk when people are using palm versus soybean. And soybean is a polyunsaturated fat, and its oil is essentially a polyunsaturated fat oil. It's liquid at room temperature. So it is more evidence that the liquid oils, unsaturated liquid oils at room temperature are preferred. Okay. If we look at coconut oil, it is the most saturated fat in our diet. It is made up of 82% saturated fatty acids. Those fatty acids are lauric, myristic acids. They're again saturated. They are medium chain fatty acids, but they're saturated. It also contains a couple of saturated long chain fats. Those are palmitic and stearic acids. And in controlled feeding studies, 6 out of 7 that have been conducted, coconut oil also raised LDL cholesterol compared again to unsaturated plant oils. And here I've included canola, safflower, there's sesame, there's a lot of other liquid oils at room temperature that can be used that are considered to be preferred, even if they're not monounsaturated fats, or high in monounsaturated fats like olive oil, they can be high in polyunsaturated fats too. So in terms of what else we know about coconut oil, there are no known prospective studies or clinical trials looking at the effects of coconut oil on heart disease. So what we've got are those controlled feeding studies. In summary then, coconut oil and palm oil are not recommended due to their saturated fat content, which has been shown to increase LDL cholesterol based on scientific evidence. That was true for both coconut and palm oils, and increase the risk of heart attacks. And that was true primarily for palm oil. So I would say if you like these or you see them in your foods, try and keep them to a minimum. Use the unsaturated liquid plant oils more often. Okay, next topic, the omega-6 to omega-3 ratio. This is something I hear a lot about. I don't know, people do come to me and ask me about this, and in general, it's a myth that it's important to have a low ratio. Harvard has actually looked at the ratio in large prospective studies. And what you can see is when you have, essentially there's not much difference is what this shows. Is there's not much of a significant difference when you compare different diets with different ratios of omega-6 and omega-3 fats. So what the academic establishment and experts say is the ratio is really not important. It doesn't seem to make that much of a difference. As an aside, I will add, it's hard to, it's actually hard to make sure you get the right ratio. It's hard to calculate it out. In other words, it's not as practical. But what is more important and really important is that to have adequate amounts of both kinds of fats in our diet. So we want both. And we'll look at where we can get some of those here. I just want to add on another issue in that a lot of times I hear again in the media that omega-6 fatty acids are pro-inflammatory. Omega-6 fats are high in nuts, seeds, and vegetable oils. And I think we've just got done talking about how a lot of these foods, whether it's in a Mediterranean style diet, Terry Pattern, or in the Nurses Health Study, were these foods and these fats were beneficial. Okay, so contrary to popular opinion, omega-6 fatty acids are not pro-inflammatory. Evidence shows they protect the heart. Okay, moving on to protein and heart disease risk. So what Harvard presented was that when you substitute protein sources for red meat, they looked at what happened in terms of the risk. And what you can see is that when you substitute poultry for red meat, the risk goes down. It's significant. Same with fish, same with nuts. When you take beans and you substitute them for red meat in your diet, you'll see that there was the biggest decrease in risk. So all of these things, the poultry, the fish, the nuts, and the beans or legumes are all beneficial when you put them in your diet and take out red meat. So the bottom line is that replacing red meats with other sources of protein, especially plant sources like the legumes, really does decrease heart disease risk. That was the extent of the protein piece. We can talk about eggs at the end if you have questions, but that was part of the course that I took, so I presented what they presented. In terms of, and maybe what I should say is, let me go back here. The other issue here, again, in thinking about this population, how important it is that you eat well enough to maintain a healthy weight and get enough protein. One way to do that is to do a lot more chicken, fish, seafood, and turkey, as well as nuts and seeds if you can tolerate those and you can eat those. You can get all the protein you need with those sources if you want to kind of stay within the realm of Mediterranean style and heart healthy. But in general, I am okay with people adding in some red meat every now and then, particularly if they like it or if their partner's cooking for them and they tend to cook more red meat or whatever it is. Harvard will say that 1 or 2 servings a week of red meat or less in general is probably still relatively safe. So you don't have to do complete avoidance, but you can and still get all the protein that you need, because you can add also healthy fats to those proteins, and or if you're trying to gain or restore your weight. Okay, so moving on then to what was discussed about carbohydrates and heart disease risk. This is a graph that basically says the higher glycemic load you have, the higher the risk. They also have another dimension here, which is BMI. So the higher weight you are, or well, maybe not higher, but the higher BMI, normal is between, say, 19 and 18 sorry, it's 18.5, or I'm going to round up to 19, up to about 25. So a BMI of 23 to 29 is considered normal, or just slightly with some slight extra weight. And the higher you go up, if you eat a diet that's high in glycemic load, and people often want to know if glycemic index is important. And what we mean by that is the amount that a food, or in this case, a load of food, might raise your blood sugars after eating that meal. So think more processed carbohydrates or refined grains and starches. And the more you get a blood sugar spike after eating a meal, the higher the glycemic load is. And it seems like when you have a high glycemic load, you're going to have a higher risk of heart disease. So the points that were taken from this is that, number one, a high glycemic load seems to be related to an increased risk of heart disease. And I mentioned that it seems like for average BMI or above, there's an even greater risk. As a side note, a lot of patients that I see with bronchiectasis or NTM have a BMI that is less than 23. And if we go back, you'll see that the risk is not as pronounced or as high. So what's interesting to me here is that it seems as though when you have a lower body weight, you may be a little bit more protected, which means you can enjoy some foods that might raise your blood sugars a little bit higher, especially if diabetes is not one of your conditions. Okay. The second thing that they showed, they looked at fruit and vegetable intake, and the more fruit and vegetable intakes you had, the lower the risk. And it seemed like there was a cutoff, meaning you got benefit from going to fewer servings to, say, 1 to 3 maybe, to more servings, maybe 3 to 5 or more. But then the more you ate, it didn't necessarily give you a whole lot more benefit. So the second takeaway for the carbohydrate section was that fruit and vegetable intake is related to lower heart disease risk. The greatest benefit seems to be achieved by getting at least 5 servings a day, but maybe there wasn't a lot more benefit after that. But that's more than what most people eat. So as I said, going from 1 to 3 servings a day to 4 to 5 servings a day is where the greatest benefits seem to reside. And what I will say here is, if you're trying to keep your weight up, maintain it, or restore it, fruit and vegetables can actually be problematic in the sense that they don't carry a lot of calories. So I generally will talk to people about, if you're going to eat vegetables, cook them in oils, grill them, roast them, saute them, add oil to them so they absorb the oil and absorb the calories, because a tablespoon of oil is 120 calories, which is great. Even a healthy oil, that many calories is great, particularly if you're trying to keep your weight on the higher side. And so you can add fats to your vegetables rather than eating so many raw or steamed vegetables. Regarding fruits, I do try and get people to consider dried fruits, or at least just not overdoing fruits or eating them first in order to we don't want you necessarily filling up on those things and not having capacity to eat other things. So fruits are good, just don't overdo them, and potentially eat them more towards the middle or end of your meal in order that you can get kind of the heavy hitting kinds of foods in first. Okay, and then the third topic under the carbohydrate section was that in general, the more healthy plant-based foods in the diet, the lower the risk of heart disease. Okay, So what we're looking at here, then we'll go to what to eat. But I would argue that what you're trying to do is eat foods that taste good, keep your taste buds happy, and keep your heart happy so that you can both love what you eat and love more. Okay, for breakfast. So another picture of oatmeal. Any kind of whole grain cereal is going to be great. We might not include as much of the croissant, but if you're trying to gain weight, why not? And you can see there's some nuts. I see some Brazil nuts here and some blueberries. I am okay with some eggs, and in general, you know, there's actually varying recommendations on eggs, but in general, between 2 to 9 eggs per week seem to be okay if you're generally healthy already. So that's one of my, I do recommend eggs, that they're a great source of protein. They're easy to cook, they're soft. And here, this one is actually combined with a lot of vegetables, and there's a rice cake here. But I do like the egg vegetable concept. Okay, so good choices at breakfast would be any kind of whole grain, including 3 to 5 grams of fiber per serving. 1 to 2 whole eggs 2 to 3 times a week, cooked in healthy oils like avocado, olive, or sunflower oils, and vegetables at breakfast, as well as nuts and seeds in small portions and fruits. If you're trying to gain weight, you can use more oil as you cook the eggs. You can use more nuts and seeds. You can also cook your vegetables in oil, as I mentioned. And I guess a little side note on the eggs, and trying to cover that topic. If you have demonstrated that you are sensitive potentially to dietary cholesterol, which most people are not, but if you are, and or if you're treated for high cholesterol, and or if you have a reason to be significantly concerned, it may be beneficial to consider limiting your yolks to 3 yolks a week or fewer. Okay. In terms of snacks, here we have yogurt with fruit, not your typical fruits. There's some figs and some kiwis, cherries, and there might be some pears or apples in there. This is like a trail mix, or just nuts and seeds and some dried fruit. Berries or fresh fruit for snack. This is granola, whole grain muffins. So good choices for snacks are low-fat Greek yogurt with minimal added sugar. Although, if you're trying to keep your weight on the higher side or restore weight, it's okay to do some of the sweetened yogurts. Fresh fruit would be good, as well as dried fruits, granola, unsalted nuts, and whole grain muffins made with healthy oils. I always encourage people to consider putting like a nut butter on a whole grain muffin. Okay. In terms of lunches or dinners, here's salmon in some lovely sauce. Greens, salads, any kind of green vegetables are good. This is a bean soup. Shrimp with grains and vegetables, very colorful, lean proteins, whole grains. More salad, this time it looks like there may be fish on there. So good choices at lunch and dinner may be legumes, black beans, think refried beans. I give that one out often as an easy recipe. Chickpeas or hummus, lentils in a soup potentially, pinto beans, could be refried beans, could just be beans in a bowl, or split peas. They're all very high in protein. Chicken, fish, or tofu, leafy greens, and whole grains to accompany the other parts of your meal. And just some final words on tips. In general, you want to go lean on protein, although fatty fish are good for the heart. So fish and seafood at least twice a week, a serving size of about 4 ounces. Try to limit your red meat to 2 servings a week or less. Add heaping handfuls of colorful various vegetables. Eat mostly plant-based, minimally processed foods. And choose more healthy fats, more avocado instead of cheese per se. Or, for example, or more nuts and seeds, more olive and other oils rather than butter, coconut, or palm. Any questions?
Thank you, Michelle. We have a question to start. If anybody else has a question, please drop it into the Q&A or the chat box. Somebody has asked the question, does fish include all seafood? Or do you differentiate the two, and how?
I actually would include fish and seafood in the same category because they tend to be high in omega-3s. They contain omega-3 fats, both fish and seafood. So I'm okay with both, and I would count both in terms of if you're trying to eat fish or seafood twice a week, I would put them in the same category.
Okay. I have actually a question for you about shrimp, and this may be one of those myths that needs to be busted, but there's been a lot, I've heard a lot about shrimp being higher in cholesterol.
Yeah, I believe it is.
It is.
But that's okay, because foods that are higher in dietary cholesterol have less of an impact on your blood cholesterol. It's really foods that are higher in saturated fat, like the butter that you might dip your shrimp in. That's the issue. So, uh, so if you cook your shrimp in olive oil, maybe some wine, under a broiler or in a pan as you're sauteing it, I would still say that's a good source of lean protein, and it's a good seafood to include in your diet, is what I would say about that. The caveat there is if you've already demonstrated a sensitivity to cholesterol, dietary cholesterol, say as found in shrimp, or you've noticed that when you eat a lot of shrimp in your diet, your cholesterol tends to bump up. If you've demonstrated a sensitivity or have a high risk and are trying to be very careful, then you may consider limiting it. But in general, I do recommend shrimp.
Here's another question. Thanks for the soup recipe. If you have heart issues trying to be healthy, yet when you do, weight instantly drops from your MAC infection, it's a hard trade-off, and do you have any suggestions?
Yeah, and this is what I see a lot of. So um, I actually, in general, always try and get people on a heart healthy track, because why not? There's probably fewer barriers when you can give people heart healthy recommendations, unless they really like the less heart healthy foods. And then I really ease up on my recommendations, because what's more important is restoring that weight. But I always go for nuts and seeds, unsalted, preferably. If you get slightly roasted, you'll get sometimes a little bit more sweetness or a little more flavor with the nuts. And we actually had a question last time about the fact that I think a woman was concerned because of her kidney stones, which I found out later that could be a real issue. Kidney stones are complicated though, but if in general, if you can tolerate nuts, I always go that direction. A cup of nuts can be 700, 800, 900 calories. It's a lot. And it just doesn't take a big volume to get a really big hit. And you can also do nut butters if they're easier to digest or easier to swallow. I also go towards avocados and guacamole, and I go towards oils. So I have people cooking with generous amounts of oil. I have people putting pesto or oil-based sauces on their foods. You can even do oil and garlic and put that over whether that's your vegetables or some kind of chicken or fish or seafood. It can just go right on top. You can drizzle oil on things. You can dip bread in oil. You can take oil and stir it into pasta or rice, or quinoa, after it is cooked. So you can take a tablespoon and in your portion on your plate, just stir it right in. What else? So I tend to go that direction. I also do ease up a lot sometimes on my restrictions if they have lost a lot of weight or if they can't maintain their weight. And then I allow things like whole fat yogurt and cheese, or whole fat milk, as well as some of the higher fat meats, because sometimes the priority is on maintaining your weight for your overall health. And when you're really sick, it's not necessarily the time to be prioritizing heart health. And also, and maybe more importantly, you're unlikely to have a lot of or significant negative effects on your cholesterol when your body is really in that fight mode and everything's going towards your immune response. The food that you eat is not going to get you into health trouble when all of your resources are really dedicated to fighting that infection. So to some degree, we can put some of those recommendations aside when you really need it.
Here's a question. What do you think about Benecol spread?
Oh, okay. What's in Benecol? Does Benecol may have plant sterols in it?
I can check.
Yeah. And, off the top of my head, I actually forget how many. There's a certain number of grams of plant stanols and sterols that seem to be beneficial in lowering your cholesterol. And I'm forgetting, I'm going to just guess it might be like, you might need like 2 or 3 grams of them. And sometimes it's hard to get that in the spread that you're using because you'd have to use a lot of the spread to get the therapeutic dose of them. But having said that, in general, I don't think that spread's doing you any harm. I think it might be helping. And so I'm thumbs up.
So here, I just pulled up the ingredients. Liquid canola oil, water, partially hydrogenated soybean oil, plant stanol esters, salt, emulsifiers, vegetable mono and diglycerides, soy lecithin, hydrogenated soybean oil, potassium sorbate, citric acid, and calcium disodium EDTA to preserve freshness, and then artificial flavor, etc.
That's interesting. Okay, so thanks for pulling that up. I do actually question whether or not that's a recent label. Were you online looking at that?
Yeah, I just pulled it up.
The reason I'm questioning it is that partially hydrogenated fats are trans fats, and they've actually been banned in our food supply for a while.
Okay, yeah, here I just pulled it up. I found another site. Canola oil, water, palm and palm kernel oil, plant stanol ester, less than 2% of salt, buttermilk, vegetable monoglycerides, potassium sorbate, citric acid, and calcium disodium EDTA.
Okay, thank you. So how much saturated fat in a tablespoon, or what?
Okay, so 1 tablespoon is 1 serving, 1 gram of saturated fats per serving.
Yeah, so that's pretty minimal in terms of the saturated fat intake. So I'm still thumbs up on it, especially if you like it. It is extra calories. Maybe the plant stanols, which are in I think the stanol esters they said, are potentially helpful. My caveat there is that I think you would have to eat a lot of that to get the therapeutic dose of stanols that has been showed to be beneficial. But I don't think that's harming you, and maybe it's beneficial.
Somebody has asked a question. We have about dark chocolate. Is dark chocolate good for us? And please say yes.
So I debated I was actually I keep meaning to feature dark chocolate. I'm gonna have to bring that in at some point. So dark chocolate is potentially beneficial in that it's known to be high in flavonols, which are like an antioxidant that are in the chocolate, particularly dark chocolate. And in general, you want 70% dark chocolate or higher in order to get a high flavonol content. And I mean, I think I love chocolate. What I've found through consumerlab.com, which is a third-party certifier, consumerlab.com maintains a subscription service to their website, which if you're interested in health, in supplements, in things like this, I actually recommend it. They review chocolate, and they talk about the fact that there's a couple of things. One is that dark chocolate can be high in flavonols, which are good for heart health. But they found that some of the dark chocolates, a lot of them actually, are high in cadmium, which is a heavy metal, which is potentially carcinogenic. I know. And so I don't know that I want to throw some brands under the bus right now, but they identified some chocolates that were high in flavonols and low in cadmium, and that's what I eat now. So I don't have any conflict of interest here, but the Ghirardelli cocoa powder, the 100% cocoa powder is one of the good ones. So I've switched my cocoa powder to that. And what I will actually do is I'll take the cocoa powder and I'll mash a frozen banana with it. And it's delicious. It's delicious. You can do other things with cocoa powder and frozen desserts, and I think that's fun. But in terms of chocolate, the Trader Joe's Pound Plus bar is high on the list. The Choco Love strong dark chocolate and extra strong dark chocolates that are 70% or higher are good picks. And you'll be able to find those in the supermarkets. There's an esoteric brand that is 100% dark chocolate, and you can only buy it online. It's a UK brand it's in my drawer over there, but I'm forgetting the name of it. But I think it's Montezuma's chocolate. Anyway, it's 100% dark chocolate, but it was the highest in flavonols. You only needed to eat like 4 squares of it to get the amount of flavonols that you would get for heart health benefits, and you wouldn't get too much cadmium in it. So you in not very many calories, you get all the flavonols that you need and not too much cadmium. And I actually love it, but most people don't like it because it's not sweet at all. But again, so sorry, I'm getting into this because this is what I like, but 70% dark chocolate, and maybe some of the brands, if you can find them that I just mentioned, would be good.
Okay. What about dark breads versus, like, I guess pumpernickel breads versus, lighter breads?
Right. That's a good question. So what you want with bread, so bread is a processed product, especially in the US, it's pretty refined and pretty rapidly absorbed, even if it's whole grain. Having said that, whole grain breads are better because they do have more of the bran or the fiber that's part of the grain. And so I'm trying to remember what's in pumpernickel. So I don't actually know. Let me actually look this up. What you want are whole grains. So it could be whole grain wheat. It could be whole grain rye. What else? What other whole grains do you find in bread here? I think those are the 2 main ones. So I don't know if pumpernickel is whole grain. And so the color is less important than whether or not it contains grains that have not been milled and the bran removed. Pumpernickel, dark, dense German bread made from coarsely ground whole grain rye. Oh, I thought it was rye. Okay. So yeah, so then that's thumbs up. So depending on what else they've put in the pumpernickel, so see what grains they've used. Sometimes they mix whole grains with a lot of not whole grains. So you want a pumpernickel that's probably dense and is made with mostly whole grain rye, but okay. So
Okay.
now I know. So that's a good choice. The other thing to look at is look at the amount of fiber on the label. So if it is a really good whole grain bread, in one slice that's about the thickness of a sandwich slice, you want at least approximately 3 grams of dietary fiber in that slice. That means you've got a decent whole grain bread.
Okay. Any resources for baking without butter, recipes for pie crust, scones, and other items that use a lot of butter?
Yeah, so the answer is yes. I was actually just talking to Amy about this. So I have found, because I've baked for a long time, I have found that you can use oil in pie crust, and it's different. I will grant you that, but I actually like it better because a couple of reasons. It's easier to make, it's faster, it's easier to make, and it's healthier. So I find it to be great tasting. I find it to be flaky, so I love oil in pie crusts. So I'm a huge proponent of that. And I do have a recipe. We may end up trying to do some kind of a cooking demo. I don't know, that's to be determined, but I love the oil and pie crusts. And where I was going with this is I have found oil to be a great substitute in almost every baked good, with the exception of cookies, although I have had some cookies that are decent, but cookies are harder to do the substitution. But in everything else, quick breads do great with oils. So what I mean by that is like muffins or a banana bread or a pumpkin bread or something like that. Cakes similarly do great with oil. So do leavened breads or doughs. Just think like a pizza dough. But like I do a challah bread that the traditional recipe would call for butter or margarine, but it's great with oil. The oil actually, I just find that the dough is more moist. So I highly recommend oils. And what I tell people is, since an oil is 100% fat and butter or margarine is more like 80% fat, if you take out, if you take out a cup of butter, and a cup of butter is 80% fat, then you've taken out 80% of a cup of fat. You replace it then with 80% oil rather than a full cup. So you might replace it with 3/4 and 2 tablespoons of oil, because if you take out butter, like I said, you're taking out 100% of something that is only 80% fat. So you need to replace it with, and you're replacing it with oil that's 100% fat, so you only need 80% of the volume. So if that makes sense,
Yeah.
you need to do the volume conversions, but you don't put in as much oil as you took out solid fat, because they're not the same percentage of fat.
What type of oil do you use in pie crust, by the way?
Right. So I use olive oil when I want a savory crust, like for a quiche. But if you're doing a sweet pie, I would recommend something that has less flavor. I've done sunflower oil, I've done canola oil. I typically would pick like an organic canola oil, which some people are concerned about GMO, and organic is non-GMO. That's my choice for a pie crust. So I'll do the organic canola oil, or I'll do sunflower oil, because I usually have those laying around, or I have them in my cupboard. But any kind of oil that doesn't carry as much flavor as an extra virgin olive oil, it could even be a more refined olive oil that has less flavor.
Okay. If someone is pre-diabetic, what do you recommend they use instead of sugar? We had talked, I think, before about monk fruit, and I know that we have a webinar coming up, I think next month actually, on how safe is sugar. And so you might be getting more into the monk fruit sweetener and other sweeteners.
Yeah.
But what do you usually recommend for people?
So stevia and erythritol are actually two of the safest sugar substitutes, as determined by both the US FDA and the Center for Science in the Public Interest, the Center for Science in the Public Interest. That's a watchdog group that checks on the government recommendations and things that are in the market, like additives like these sugar substitutes. And so I always recommend stevia, and erythritol I've been seeing more now, and so I recommend that one as well. Most of the other ones do have some kind of caution, most of the other ones have some kind of, there's some hesitancy on the watchdogs group's part. So I do feel good about recommending stevia and erythritol.
We have somebody asking, what about their beloved cheese?
I know women love cheese. I love cheese. So
Doesn't.
In the ideal world, if you can maintain a healthy weight, you don't need cheese to like keep your weight up, then I would tell people to eat 1 or 2 ounces of full fat cheese a week or less. That's not very much cheese, by the way. So get familiar with what a portion size is and what an ounce actually looks like, and then decide if you can kind of wean yourself down and eat small amounts and really appreciate a good cheese just in smaller amounts. I honestly, when I do cheese now, like I do omelets with a little cheese, I probably use 1/2 ounce, which means I can do it for most days of the week. So I encourage people, number one, I guess, to try and use more avocado and guacamole, as literally just use more of that and less of the high fat dairy, whether that's cheese or sour cream. And then when you do cheese, I would make it like a really strong special accent to a meal, but really try to minimize it. So you're not eating really cheesy meals is what this boils down to. Or if you are, they're a special occasion, once a month or fewer. I'm thinking like enchiladas buried in cheese, or like smothered burrito or something like that should not be what you're eating normally. So I would try and make cheese really a special treat, a special kind of accent. I know it's not the best news, but that's what I do. And the other thing to do is if you feel like you're eating a little more cheese than that, then monitor your cholesterol numbers. You may not be as affected by it because honestly, an ounce of cheese contains about 6 grams of saturated fat, and most people want to eat about 15 grams or less of saturated fat a day. So you can have some cheese, but try and fit in if that's where you want to spend your budget, try and use it on the cheese and then try and take it out of other parts of your diet. To try and then see if your cholesterol levels are okay. And if they are, then you're probably doing a good job of moderating.
Somebody's asking about salt. If you have normal blood pressure, is salt that bad for you?
So that's a great question. And I'll give a couple of things come to mind. So even if you have normal blood pressure, high sodium diets may increase your risk of bone loss. This is something that a lot of people don't think about, but I think about it because I have normal blood pressure and I have small bones. So when your kidneys excrete a sodium load, if you are to eat a high sodium diet, especially on a regular basis, or even if you're eating a salt load in a big meal, your kidneys have to excrete that sodium. And when they do that, they send sodium out with calcium. It's like a co-transporter. They go out together. And your body may have to buffer that calcium loss with something, and it may be your bone. So it is actually generally held to be true that high sodium diets may predispose to bone loss. And I think that's a huge issue for postmenopausal and older women and small boned women or women who have a familial predisposition. So I would argue that even if you have low blood pressure, you should still try and eat a lower sodium diet. And what I mean by that is the current dietary guidelines actually provide a guideline for people who do not have high blood pressure and are generally heart healthy already. And that is a sodium limit of about 2,300 milligrams of sodium or less a day. And that requires effort, in my opinion, for most of us who live here. And we're used to a higher sodium foods and adding more salt to our food. So that's my recommendation there.
Okay. We have a question from someone who is struggling to gain and maintain weight. They've lost some weight and they have bronchiectasis. They don't have heart issues, but they've had kidney stones in the past. They have gluten-free diet. Do you have any suggestions to help with possible weight gain?
Right. So I, my initial response is some people are tricky. Kidney stones are tricky, and the story can, even if oxalates are an issue, usually it's not just about oxalates. There's other factors that might contribute, and so you can kind of try and mitigate a bunch of them. But what you may need is actually just more individual attention, because it's hard to give an answer. I did try and explain that oils, anything that's high in oils, and it could be adding pesto to food, adding a tapenade to a food, using more oil in your cooking, that's generally always safe for the conditions that you mentioned. And so that can be an easy way to go. You also might need supplements, like a supplemental drink, something that would be safe for the kidneys, in order to just concentrate enough calories. You might need maybe energy bars or something that's just going to be really concentrated in addition to the higher calorie foods that you're able to safely eat. And I know that's not super specific, but it's hard for me to generalize when I don't know the whole medical picture.
Okay. Another question, any suggestions for those who try to eat healthy oils to gain weight, but whose bodies don't process oils and fats well?
I know that's challenging. That's challenging. And honestly, and I hate to rely on supplements because people always wince and they don't like Booster and Sure, but you might need some kind of concentrated, let's see, what could you put in there?
Just as an aside, when
Yeah.
Fern was alive, Fern was my stepmother and she founded NTM Info Research. When she used to have like the Boost or Ensure shakes, she used to like put it in a blender with some like fruit and other stuff and basically make it a smoothie.
I know.
It made
I
it much
know.
more palatable for her. So that might be
Yeah.
a suggestion for some people.
Yeah, I mean, and this is where like it's helpful to actually sit down with someone and talk to them about what you're able to eat and what you can eat and what you like and what you don't like, because like you could make a shake, you could put in PB2, which is a peanut butter, fat-free peanut butter protein powder. You can use other protein powders. The other question is, how much fat can you tolerate at any one given time? Like, can we spread it out? And is fat in certain forms more tolerant, in other words, in food, like a peanut butter, more tolerable than an oil? You know, so the question, I would kind of look for the amount, the threshold that you can tolerate and use that, and then try and pack in some extra calories, probably with potentially, depending on how important the need is for those extra calories, look for other supplemental products that are more convenient ways to just concentrate the calories, like these protein powders or some of these bars that just find ways to pack in the calories because they have additives. They're adding things to their food that aren't just normally in natural foods.
Okay, thank you. We have a question. Somebody wants to know, is it okay to have a biscotti once a day?
Oh, once a day. Is that your food group? Your biscotti food group?
Listen, some people consider, chocolate a food group. It happens.
So I think the answer has to be yes here. I mean, just because I like making people happy, but no, in seriousness, biscottis are usually small. Usually they're high in fat and sugar. But what I'm banking on here is that usually they're, well, they're not like big, gigantic donuts. They're like kind of these small treats. And the amount of saturated fat and sugar in a biscotti is actually probably not going to be too excessive. So maybe that's where you can spend your budget.
So maybe pay attention to the label and then, find a biscotti that works for you, kind of.
Yeah, I mean, it's everything in context, like depending on what you need to do with your weight. I mean, if you really needed to gain weight, my answer would be definitely yes. But if you're generally a healthy weight and you're trying to stay healthy, then you're trying to stay within the range that's still considered healthy. You're trying not to overdo the saturated fat. You're trying not to do excessive sugar, but I doubt you're going to overdo it with one biscotti.
Okay.
That's my opinion. And then, yeah, I talk to even people about, again, depending on what your weight is, if you're generally a healthy weight and you're trying to be healthy, maybe you could have the biscotti after lunch before and then during the day, you're kind of going to be active and work off some of that sugar, and, it'll give you some of the some energy, and that's not a bad thing. It's a good thing. So in moderation, I think it's potentially a yes from me.
Is pink Himalayan salt better for you?
Maybe by this much. I actually was reading about the pink Himalayan salt, and the pink Himalayan salt, as well as other kind of boutique salts, will have higher amounts of trace minerals usually. It's usually not enough to make a significant difference. So I would, if you like the taste of it, then go with that. Or if you like the texture of it, oftentimes with salts, I like the coarseness of it, or how it's been crushed or whatever. So if you like that and that affects the taste, and you don't need to use as much of it, so you don't get as much salt, go for it. But I would not use those salts because they have a potential trace mineral benefit. That's my opinion, and that's generally the opinion of medical and academic experts in the field.
Somebody wants to know, what about cottage cheese?
Yeah, so cottage cheese is a good protein, good source of protein. It can be very high in sodium. There are some brands that are lower sodium. So again, depending on your situation, you can use a small portion of it in order to keep the sodium lower. You can choose a low sodium brand. I think Lucerne, like here in my area in Colorado, Safeway carries Lucerne brand low sodium cottage cheese. I don't know what might be in your area, but you can compare the sodium content and see if you think it's worth it. In general, it's going to be a little bit better. And it's a good source of protein. A half of a cup of cottage cheese may have 12 or 14 grams of protein, which is great. If you need the extra calories, you can do full fat. If you don't need the extra calories, you can do the low fat or non-fat.
Okay.
It's also low in lactose, by the way, so that can be more tolerable for people who are more sensitive to lactose.
Somebody is asking, is there a pea-based protein powder that you like or would recommend?
Yeah, pea-based. So let me think in terms of a protein powder. Gosh, I don't know one off the top of my head. What comes to mind though is that Kate Farms is a supplemental drink, and they rely on pea protein. And I actually love the taste of Kate Farms. It's expensive though, FYI, but it can be a good alternative for some people who are looking for plant-based and willing to invest the money in that. In terms of a powder, I don't know one off the top of my head. A lot of the powders in stores are like made from brown rice, or if they're plant-based, or soy or hemp. I have to imagine there's one of pea, but I don't know one off the top of my head.
I know that Amazon, their 365 everyday value brand, they do have an organic pea protein unflavored powder.
Oh,
I mean, I know about it. I haven't tried it, but I know about
thanks,
it.
Amy. You're my lifeline.
Well, I like to Google.
Okay.
Someone is asking, could high cholesterol be the result of a low BMI from an infection if their cholesterol was low before? Like,
No, that's interesting. I'm not aware of the mechanism for that. I also don't see that a lot. So as far as I know, no, but I don't know everything, and it sounds like you have an interesting presentation. So yeah, I don't know.
okay. Well, that concludes, those are all the live questions that we got. There have been requests for a couple of recipes, which I will, oh, no, wait, we have another one. What is your recommendation regarding sodium limits?
If you're generally healthy, don't have high blood pressure, I will generally say 2,300 milligrams of sodium a day or less is a good target. By the way, you can use, oh, did I? What happened to me?
No, it's okay.
Oh, okay. You can use a little bit of added salt in that budget. You have to, it's about 1/8 of a teaspoon approximately, which is 300 milligrams of added sodium. So I'm okay with a little bit of added sodium if, again, you're generally healthy, don't have a blood pressure issue. If you do have a blood pressure issue, or if you're salt sensitive, and you're salt sensitive if you retain fluid, especially when you eat a salt load or eat a high sodium diet. If you're prone to fluid retention, then you may need 1,500 to 2,000 milligrams of salt, or even less a day. The body really only needs approximately 500 milligrams of sodium a day for vital functions. So you don't need a lot of sodium. It's just hard to achieve some of these recommendations in our current culture and food environment, and when you rely on more packaged or processed or convenience foods. And if you have a taste for salt, which most of us do.
Somebody actually posted a comment in the Q&A that they take Lipitor and when they're on medications for NTM, apparently rifampin it tends to, I guess, they said it eats up Lipitor, so it probably has some kind of binding effect. So their cholesterol goes higher when they're on those meds.
That's interesting. Okay. And based on my limited understanding, when certain drugs, antibiotics, are metabolized in the liver, they can kind of speed up or slow down the breakdown of other drugs. So it sounds like rifampin may speed up the breakdown of Lipitor, which means you don't sustain, I'm working through this in my head, which means your levels of Lipitor are lower, and therefore because of the rifampin, and therefore your cholesterol levels may be higher. Am I following this correctly?
Yeah, and it sounds like that's what's happening, is that the rifampin is somehow interacting
Yeah,
and
so
causing the Lipitor levels to,
yeah,
I
and
guess,
I
go
think
lower.
so. Thank you. I think this is someone who's addressing the previous question of why have my cholesterol levels gone higher, and maybe the question to ask is, are you on a cholesterol lowering drug like Lipitor, and are you also on rifampin? In which case you might get that interaction, and maybe that's the cause of it. So yeah, thank you. I didn't know.
Okay. So we had a request from somebody to share some recipes that you have for pie crust used with oil and the challah with oil. So we will get those recipes and share them. And also in your presentation, you had a picture of salmon in some kind of sauce that I don't know what that sauce was, but it looked amazing.
You know.
So we might have you share that one as well.
So that's not my picture. I'll see if I can find it though. I had the same thought.
I don't know what that recipe was, but it looked amazing.
I know.
But we will be sharing more recipes from Michelle. And so as we share those, somebody's asking for a cookbook from you, Michelle. Well, we're working on something for that. So you will be getting more recipes from Michelle, I promise you.
That's sweet.
We will be getting more recipes from Michelle. Somebody's asking, where will we share the recipes? We are sending them out via our email newsletter. And we will make sure we post them online as well on our website. But if you're signed up for our newsletter, you will get the recipe when it's sent out. So thank you, everybody. We're very excited about your enthusiasm. We're happy you joined us. We're looking forward to building a whole repository of recipes and getting a cookbook going. This is great. Thanks everyone for joining us, and we look forward to seeing you at our next webinar. Everybody have a wonderful week, and we'll see you soon. Thank you, Michelle.
Thank you.